we manage stress. Stress is part and parcel of our life. Whether we like it or not, we are going to have it. So, human interaction, how body responds to stress, how we should actually respond or how we should make it less stressful. This is something which we are going to briefly talk about. Something which is manageable at an end user level on a day-to-day basis. So let me start with what is stress by definition? It is basically an inability for an individual to perceive that threat. The moment you are exposed to either a real or imagined kind of a situation which is going to cause some level of threat to the body goes into a predefined response. That is basically stress. If the stress is continuous or persistent over a long period of time, it is likely to affect both our health, our productivity, our social life, you name it, every aspect can be affected. So stress, inherently, we are born to deal with it, but the question is, are we dealing it in the right way or not? Unfortunately, psychiatrist is not mentioned anywhere there. So I don't know whether mine is a stressful or not a stressful job. I think it is. But these are some based on the US survey. A lot of the most stressful and the least stressful kind of jobs. Anybody fit into any of these categories? Right. Okay, event management, my God. Absolute nightmare. Okay. Anybody else?
7.
Senior executive. Extremely, because you are responsible for so many other people under you. So that is number of times you are multiplying into in terms of stress. Professors, dietitians, medical record, librarians.
Professor.
There you go. Be stressful. Looks upon him. Okay. What is the stress continuum? See, as I said, the moment if there is a line entering, there's only one single exit from this particular room. We all need to panic. That is our immediate kind of short-term response. Fight or flight. Our body is programmed to do only one of those two things. Either you think about fighting that lion and making your way out, or just make it run. So that is your acute response. But what if the lion decides to kind of sit there, and you are also stuck because there is no other exit there? Then the body starts to adapt itself for the stressful response. If it is over a prolonged period of time, then the resistance and the exhaustion will set in eventually. That is a natural programmed response of the body. When things like exhaustion happens, as the next slide will show, this is what the initial response is. The body gets prepared for that fight or flight. Suddenly the heart will start racing, then your muscles and all will go into an absolute spasm. The circulation will start gushing around the body, mainly to the brain, to some of the very key centers which are involved, and hence you feel that flushing of the face. It's just those kind of experiences when you walk into that interview room for the very first time, or just before you enter the examination hall as a student. The kind of anxiety is, for some people it is quite okay for them to be anxious, because there are a lot of positive aspects also when people are anxious. But again, when the resistance stage sets in, that is when the body kind of starts to get exhausted because the adrenaline is not there anymore for it to kind of keep pumping. And then the fatigue, the anxiety and the tension starts setting in. Eventually, there's only that much the body can produce in terms of the adrenaline. And once that is actually exhausted, there is no more adrenaline that can be released. As I said, stress is not always bad news. At the peak of the adrenaline production, the performance is going to be absolutely fine. Because this is where you would want to kind of have the optimum level of performance, which is when you are starting to kind of speak much more clearly, much more trying to gather your own thought process. But once the anxiety zone kicks in, this is the famous Yerkes-Dodson curve, wherein once it gets to the stress zone, that's when the panic and the anxiety symptoms will start setting in. That's when your performance starts to kind of just goes downhill. How many people would agree on this kind of a model wherein their life is divided exactly into each and every aspects? How many lucky people are there in this room who have an absolutely fantastic work-life balance? ಎಷ್ಟು ಜನ ಅವ್ರ work or life balance ಈ ತರ ಇದೆ? ಯಾರಿಗೂ ಇಲ್ಲ, unfortunately. ನನ್ನ ಲೈಫ್ ಈ ತರ ಇದೆ. Unfortunately, we end up working almost 2/3 of our day just doing work, and everything else gets squeezed into the remaining one, which is where you got to try and reverse it. On the contrary, this is how at least you can aim for. Yes, it may not be ideal in all realistic terms, but at least you can aim for something like this. ಈಗಿನ ಕಾಲದಲ್ಲಿ ಎಸ್ಪೆಷಲಿ ಇರುವ ಒಂದು ಟೈಮ್ ಪೀರಿಯಡಲ್ಲಿ ಯಾವ ಏಜ್ ಗ್ರೂಪ್ ಇಸ್ ನಾಟ್ ಮಾರ್ಟಿ ಫ್ರಮ್ ಸ್ಟ್ರೆಸ್, ಎಸ್ಪೆಷಲಿ ಸ್ಟಾರ್ಟಿಂಗ್ ಫ್ರಮ್ ಚಿಲ್ಡ್ರನ್. ಚಿಕ್ಕ ಮಕ್ಕಳಾಗಿದ್ದಾಗ ಸ್ಕೂಲಲ್ಲಿ ಪ್ರೆಷರ್, ಓದು ಚೆನ್ನಾಗಿ ಓದು, ಡಾಕ್ಟರ್ ಆಗು, ಲಾಯರ್ ಆಗು, ಅಥವಾ ಏನಾದ್ರು ಆಗು, ಒಟ್ರಾಸಿ ಓದು. ಅಲ್ಲಿಂದ peer pressure start. They are pushed right from the word go. You start kind of pushing them, perform. Then they somehow manage childhood and then come to the teenagers. Then they have all that company kind of issues, peer pressure, as in ಅವನು ಯಾರೋ ಸ್ಮೋಕಿಂಗ್ ಶುರು ಮಾಡ್ಕೊಂಡ, ಇನ್ನೊಬ್ಬ ಕುಡಿಯೋದು ಶುರು ಮಾಡ್ಕೊಂಡ, ಅವರೆಲ್ಲ ಒಟ್ಟಿಗಿರ್ತಾರೆ, ಚೆನ್ನಾಗಿ ಮಜಾ ಮಾಡ್ತಾರೆ. ವೈ ನಾಟ್ ಮೀ? Why can't I also be like them? So the peer pressure on all the good or bad things, it's not always bad things, but ella taranu pressure does start. Somehow you manage all that college and get into the adulthood. Job, ಕೆಲಸ ಸಿಕ್ಕಿದ್ರು ತೊಂದರೆ, ಸಿಗಲಿಲ್ಲ ಅಂದ್ರೂ ತೊಂದರೆ. If you get a good job, is it a better pay, better work prospects, better future? And gone are the days when people work with loyalty as a mantra behind. Nowadays, it's personal progress. They want to progress as fast as possible. So the rat race continues. Middle age, well, even earlier to middle age. Again, if you don't marry, there is certain kind of pressure. If you marry, I won't say anything about it. Then kids, how they kind of develop. ಮನೆ ಇದೆಯಾ, ಅದೊಂಥರ ತೊಂದರೆ. ಅದು ಮನೆ ಕೊಂಡ್ಕೊಡೋದಕ್ಕೆ ಇನ್ನೂ ಒಂದು ದೊಡ್ಡ ಯಜ್ಞ ಮಾಡಬೇಕು. Come to the latter part, then all your health issues start to accumulate, start to bother things. So even if you have a very good family balance, the health is one of the kind of entities which start to affect your own day-to-day proceedings. So what are the consequences of stress? Obviously, when individuals go through the acute stress response, as I said, the heart will start pumping, blood pressure will increase, they'll start getting aches and pains in the body, they'll start kind of having all the features of an acute panic. There are also psychological symptoms. ಅಂದರೆ ಯಾವ ಥರ ಒತ್ತಡ, ಮನಸ್ಸಿನ ಒತ್ತಡ, ಟೆನ್ಷನ್, ಕೋಪ ಬರೋದು, ದುಃಖ ಪಡೋದು, ಕೆಲ ಸಮಯ ಎಮೋಷನಲ್ ಆಗೋದು. There are a lot of kind of negative contexts also wherein people will start thinking about, will I actually succeed in my life? Will I actually hit the aim that I am actually targeting? What if that doesn't happen? What if my life doesn't pan out? These what ifs and hows and whens will start kind of tormenting them to such an extent that they stop enjoying life. Behavioral symptoms. Again, sickness absenteeism is one of the most common kind of problems that people come across. Lot of bad behavior or habits like smoking, drinking, and bad social activities. All these are, again, they are consequence of the so-called stressful life that we live. Why does stress affect some people and not everybody else? It's like her you can listen, whereas some people can't stop talking. It's the way how they perceive stress. It's not necessarily an individual's kind of a makeup or a genetic makeup that the individual is born with that dictates what the stress response is going to be. So if you have had a very bad or a traumatic childhood, the way how you perceive stress is very different to someone who's never been exposed to stress. And this has been kind of evidence-based right throughout as to individuals, how they become personality disordered purely because of their childhood experiences is one consistent factor that comes out even when people are in anxiety kind of disorders. So it's how people perceive stress is one of the most important factors. Their own experience about how they handle stress. Some people are very calm. ಏನು ಬೆಟ್ಟ ತೆಗೆದು ಅವ್ರ ತಲೆ ಮೇಲೆ ಹಾಕಿದ್ರು ಕಾಮ್ ಆಗಿರ್ತಾರೆ. ಅದ್ರ ಬಗ್ಗೆ ಜಾಸ್ತಿ ತಲೆನೇ ಕೆಡಿಸ್ಕೊಳ್ಳಲ್ಲ. They will not actually break even a sweat even if the company is going diwala. But it's not that they are not experiencing stress, it's the way how they kind of project it across also. A lot of people talk about social support because there are a lot of times that families are becoming more and more nuclear. Nowadays there's also this fact that if husband and wife are together, we call it a joint family. Because it's come to that kind of a state, because gone are the days when people used to have extended and even more relatives pouring in left, right, center. Because when I used to grow up, there were probably 8 to 10 people always there in the house. And that kind of exposes you to a lot of different kind of scenarios that you have to manage. So the dependence on parents were very, very minimal. Whereas in this day and age, you are entirely dependent on your mom and dad who are also working. So there's hardly any kind of social support around you. That also dictates how well the body or the mind perceives stressful situations. don't talk too much about the locus of control because that is more to do with how psychologically minded an individual is. Because if you feel, oh, ನನಗೆ ಯಾಕೆ ಈ ಥರ ಆಗ್ತಾ ಇದೆ ಯಾವಾಗಲೂ ಪದೇ ಪದೇ ನನಗೆ ಈ ಥರ ದುರ್ಘಟನೆಗಳು ಆಗ್ತಾ ಇದೆಯಲ್ಲ, why am I in the receiving end all the time that so much of bad things happen to me? If I go to work, my boss fires me. If I come home, my husband fires at me. If I am with the kids, they don't want me. So it's that kind of hostility or that loss of control over a particular situation which also dictates why individuals kind of react differently to different stressful situations. Any questions until now? Because we'll start thinking about how do we manage stress. First and foremost, acknowledge the fact that you are going through a stressful period. The worst thing is not even responding to the fact that your body or the mind is going through a continuous period of stress. If you can't identify, you cannot do anything about it. Adikoskarane, they have given you all your questionnaires. Questionnaire is one way of trying to kind of do a tick box. But it is not, you know it best whether you are going through a stressful period or not. Nobody else need to tell you what it is. But definitely think or introspect what is your body going through or what your mind is going through. Simple time management. ಇವತ್ತಿನ ದಿವಸ ಏನೇನು ಕೆಲಸ ಮಾಡ್ತೀವಿ ಅಂತ ಬೆಳಗ್ಗೆ ಎದ್ದಿದ ತಕ್ಷಣ ಒಂದು 5 ನಿಮಿಷ ಒಂದು ಯೋಚನೆ ಮಾಡಿ. What am I going to do today? How is my day going to be planned out? It doesn't have to be written on stone, but at least you can plan well in advance. Manage your time. It goes by the very simple Pareto's principle. 80% of our effort goes into doing 20%. Whereas the remaining 20% is what we are giving to the more important aspects of life. So, reverse it. Action plan. There are definitely going to be a lot of stressful things that you will come across. Have some kind of a plan. ನಮ್ಮ ಅತ್ತೆ ಮಾವ ಬರ್ತಿದ್ದಾರೆ ಇವಾಗ, ತಲೆ ಮೇಲೆ ಕೈ ಇಟ್ಕೊಂಡು ಕೂರೋದ್ರಿಂದ ಏನೂ ಆಗಲ್ಲ. ಹೇಳಿ ಓಕೆ, ನೆಕ್ಸ್ಟ್ ರಿಟರ್ನ್ ಟಿಕೆಟ್ ಯಾವಾಗ ಬುಕ್ ಮಾಡ್ಬೋದು ಅಂತ ಯೋಚನೆ ಮಾಡ್ಬೋದಾ? It's about having some kind of an action plan to reduce your own stress levels. Again, relaxation techniques that my dear friend will cover in a lot more detail as to what you need to do. Social support, as I said, is something which we have lost over a period of say decades, is the art of socializing on a personal level. ಈಗಿನ ಕಾಲದಲ್ಲಿ ವಾಟ್ಸ್ಆ್ಯಪ್ ಅಲ್ಲಿ ಎಲ್ಲರಿಗೂ ಲೈಕ್, ಫೇಸ್ಬುಕ್ ಅಲ್ಲಿ ಲೈಕ್ಸ್ ಹೊಡೆಯೋದೇ ಇಸ್ ದ ಕರೆಂಟ್ ಟ್ರೆಂಡ್. ವೆರಸ್ ಅವ್ರ ಎದುರುಗಡೆ ಬಂದಾಗ you have not more than 5, probably 10 minutes of conversation. Because after that, even if you are on the phone, ಆಮೇಲೆ ಇನ್ನೇನಾದ್ರೂ ವಿಷಯ ಇದೆಯಾ? You already tried up that conversation. There isn't anything else that you are able to converse with. Again, tips which I often tell a lot of our patients, and their patients agadik munche, these are some of the preventative entities that you need to kind of consider. But once you have already become into a disorder, you need professional help. At least family members jothe yavaga time spend ಮಾಡಿ. ಖಂಡಿತ think about your own strengths and weaknesses. We are not perfect. There are a lot of people around us who can help us out. ತೊಂದರೆ ಇದ್ದಾಗ ಖಂಡಿತ help ಕೇಳಿ. That is not a sign of weakness. Instead, they will appreciate because you are asking them for something which they are good at. Again, if you are religiously based, this is only to hint that meditation is also very, very useful in reducing stress. And consider having a very, very good physical health also, because there's a lot of evidence pouring out, especially now that your International Yoga Day is also being celebrated. We definitely have lots more to offer when it comes to yoga. Again, at a personal level, eat well, sleep well, have regular exercises, and think about how you can have some good time also. Recreation is very, very important. See, when we were young, we used to go on LTAs. I don't know how many people were part of those going with parents on LTAs. That used to be one annual trip that was absolutely booked, compulsory. Whether we liked it or not, we had to go. How many people go nowadays? Yes, you might be able to travel across the globe, but as a family, with your parents, with your family members, how often do you travel? Especially in the name of vacation. Something which you need to do. But definitely, if you feel after doing all this, you're not getting any respite, seek professional help. There are plenty of professionals out. They can help you. Just a bit about organizational approach, because obviously there are people who manage a lot more people around them. Think about what kind of people, the right people for the right kind of jobs. Even if you are desperate in terms of recruiting anybody, do not pick the wrong person. It's a recipe for disaster. Smart goals, very much specific, measurable, achievable, researched and time specific. So definitely have certain goal settings. Obviously, if there are people who are getting frustrated with their jobs, do something about redesigning their jobs or redefining their responsibilities or roles. Make it a bit more exciting. Do something. Increase their involvement in doing job descriptions or job reviews rather than sending emails. Definitely call them, have a face-to-face kind of an encounter. Communication. See, again, something which we take for granted. The fact that we don't have English as our mother tongue is the biggest fallacy. So whenever we are communicating, do think about communicating in the language that is comfortable for both parties. See, having been in UK for almost 12 years, I still feel English is a very, very difficult language. And communicating in English is even more harder. So definitely take a lot of precautions when you are communicating. And wellness programs. Nowadays, all MNCs, if not most MNCs, have a lot of these wellness kind of programs. Wherein again, it's become more like a tick box exercise. Have they done health and safety? Have they done coping with stress? I'm sure the stress management is branded across left, right, center, and a lot of non-medicals also do it. But the key is understanding where stress originates and how you deal with stress. Again, these are some of the programs that we have started, because stress is not limited only to physical aspects. Jana smoking and there are a lot of people who get on with this. How many people know about the units in alcohol? Everybody, don't answer. But general rule is Western standards any kind of individual in 7 days you should not exceed more than 21 units, and that has to be staggered over a period of 7 days. If you are drinking all 7 days equivalent over a weekend, that also becomes a problem. It's called binge drinking. But these are some of the common kind of measures. And now ಎಷ್ಟು ಕುಡಿತೀವಿ, ಯಾವ ಥರ ಕುಡಿತೀವಿ, everything comes into the picture. But still, not a mechanism. Alcohol is a double-edged sword. The first drink will elevate your mood. After that, it will only kind of pull you down. It is the most powerful depressant man has ever invented. ಅದರಲ್ಲಿ ನಿಮ್ಮ ಮನಸ್ಸನ್ನು ಕೆಳಗೆ ಎಳೆಯೋದಕ್ಕೆ, ಡಿಪ್ರೆಷನ್ಗೆ ಆಳಾಗೋದಕ್ಕೆ, this is one of the biggest contributors. Definitely doesn't work. So does this. Lot of illicit drugs. Bangalore is supposed to be the South India's capital for illicit drug use. We still don't know who is using and if they are in trouble, where are they getting all the necessary help. There's very, very few kind of medically run centers where people can go for detoxes. Certainly something which it does not help in the long term. Illicit drugs only, there are a lot of people who abuse prescribed drugs. Zolpidem, Restil, Anxate, halvar medicines. There are people who just use it for years and years. Not useful. Again, you are subjecting yourself for an artificial suppression of your stress response. Not helpful in the long run. Relaxation. Again, Shashikant will cover in much greater detail how yoga can be used as one of the major tools to kind of achieve the relaxation process. Definitely sleep well. Any questions? ಏನಾದ್ರು ಪ್ರಶ್ನೆಗಳಿದೆಯಾ?
You said about the doctor that childhood experience, how people go. So is that a positive thing or a negative thing?
It works both ways. See, someone who is often the kind of stories that we come across is a lack of parental support. See, if they have a good genetic makeup, they are much more good in trying to kind of focus their frustrations onto better things. So they cope with striving for something which they have never achieved. Whereas it can also have the other side of it, which is they are unable to kind of control their own emotions. So it becomes a downside. And they just can't handle any form of stress. So even a minor kind of an argument becomes very overwhelming.
The reverse thing, if a child has never experienced stress, so is that again the same?
That they tend to kind of manage stress much better. Purely because they are constantly kind of having that level of self-confidence. Because if